Ms. Bladder Management, How to Stop Nocturia. If you find yourself waking up multiple times during the night to urinate, you are not alone. Nocturia is a common issue for many with multiple sclerosis, but there are ways to manage it effectively. Understanding what causes nocturia in Ms. is the first step. It often results from an overactive bladder, which is when the bladder contracts involuntarily, or from a reduced bladder capacity that can't hold enough urine overnight. Sometimes, incomplete bladder emptying or increased urine production at night, known as nocturnal polyuria, play a role. Other factors like urinary tract infections, drinking too much fluid before bed, caffeine, alcohol, or sleep problems can also contribute. It is important to have a healthcare professional evaluate these symptoms to rule out other conditions like diabetes or hormonal issues. Lifestyle changes are a good starting point. Try to limit fluid intake in the evening but stay well hydrated during the day. Avoid caffeine and alcohol in the hours before bedtime because they can irritate the bladder and increase urine production. Establishing a regular sleep routine can also help reduce sleep disruptions that make nocturia worse. Bladder training and pelvic floor muscle exercises can make a real difference. Strengthening the muscles that support the bladder can improve control and reduce urgency. Techniques like biofeedback or neuromuscular stimulation may be used to enhance these exercises. These therapies can help decrease the number of times you wake up at night to urinate. Medications are often prescribed for overactive bladder symptoms. Antimuscarinic drugs and beta-3 adrenergic agonists can increase bladder capacity and lessen involuntary contractions, which may reduce nocturia. In some cases, desmopressin, a synthetic hormone similar to vasopressin, is used to decrease urine production at night, but it should only be used under medical supervision. If incomplete bladder emptying is an issue, alpha blockers might be considered, but many patients benefit from clean intermittent self-catheterization to prevent urinary retention. Neuromodulation therapies like percutaneous tibial nerve stimulation involve mild electrical stimulation near the ankle to help regulate bladder activity. This non-invasive treatment can be a helpful addition to other therapies. For those with significant difficulty emptying their bladder, intermittent self-catheterization can prevent retention and reduce nocturia episodes. Most importantly, it is essential to consult a healthcare provider experienced in Ms. Bladder Management. They can evaluate your specific situation, identify underlying causes, and develop a personalized treatment plan. Addressing nocturia often requires a combination of lifestyle adjustments, bladder training, medications, and sometimes neuromodulation or catheterization. With proper management, many people find relief and enjoy better sleep and quality of life. Remember, every individual is different, so working closely with your healthcare team is key to finding the best approach for you.